Now.
You should rap, doctor.
Now this just became very uneducational.
So we're looking at the cow heart here. This is a valve going into the left ventricle. We know it's a left ventricle because we look at the thickness of this ventricular muscle compared to the thickness here. This is a lot more thicker, so we would know this is the left side of the heart. This muscle in the middle, what would that be called? Interventricular septum. So now we're in the left ventricle. The blood is going to flow through this valve, go in. So what is the valve that leads from the the atrium to the left ventricle? Mitral. When the left ventricle contracts, the mitral valve is going to try to close upward. The chordae tendineae are going to pull it back so it doesn't pop into the atrium. Do you see that?
So what's a mitral valve prolapse? Is that
mitral valve prolapse is when the valve is going back into the atrium and prolapsing into it.
Is it when the tendon things are not there?
It's not. They're there.
Sweet.
If you cut this, it's called regurgitation. One valve is just popping up.
So prolapse just means it goes in or inside out.
It bulges inside out, and there's a little bit of flow back.
That's the right, left. Oh, they cut theirs. They cut theirs right, left. Vertical. I like yours better.
So what is the thing that you were saying that it like kind of goes down and then branches off into two?
Okay, so you got
I think I'll have
the
red.
bundle of his coming down here, and it branches into two called the Dr.G fibers. This is the neural pathway, comes down, branches across, and it's inside the muscle tissue. The muscle tissue, the myocardium is actually doing the conduction itself. You guys remember the gap junctions? Where all the cells are synchronized? So the signal is going through, and then the heart is going to contract together. Let's see if we can find your coronary artery. So we got the left ventricle. This is mitral, so this is, do you see? The mitral is here, and then now we're exiting the left ventricle. What would that be called? When blood exits the left ventricle, goes through the big elastic artery up here, aorta. So what should we expect next to the aorta? Coronary arteries. Remember, we got to supply the heart with oxygen as well. Papillary muscles?
No, it starts P-U-L.
Pulmonary?
Pulmonary, where's that?
Let's go through the coronary. No, pulmonary will be coming off the right side. Did I cut the coronary artery? Yeah, because it's...
Oh no, he didn't cut it. This didn't have a coronary artery.
There you go.
It's cut halfway. Yeah. The picture is like yes. When you are seeing it.
It's crazy looking.
The blue one which it flows to is this one. That's the pulmonary tract.
We're gonna put it on YouTube. It'll be like Dr.G's instructional videos.
See that? That would be the coronary artery.
Oh, that's the one you told us it was.
Yeah, it looked like the sinus. I know it looked like a vein, but you see how it's staying open?
Yeah.
Arteries are elastic, they stay open. The veins are more collapsible. This would definitely be an artery. I'm not sure if that's an artery. This is definitely an artery. You can see the thickness of it, the elastic fibers around it, right? You see this little branch coming down? It's like one of those marginal branches supplying the muscle as it travels down. Do you see the marginal branch? Can you see the coronary artery? Okay. Yeah, I think that's good.